This conference will
talk.
now be recorded.
So hold on just 1 minute. Can you all see my screen? Or Jose, can you see my screen?
I can see your screen, yes.
Okay, great. All right. So, like I said, real pleasure to be here and be on this call today. I'm like Dr. Leon said, I'm Thomas Carr, National Director of Policy for the Lung Association, and I'm here to talk a little bit about, give some background and kind of summarize recent events concerning e-cigarettes. And I'll say it's been a really eventful period in terms of e-cigarettes and youth in particular, and youth use in particular. So as you see on the screen, e-cigarette use among youth in the U.S. is kind of an epidemic at this point. Just yesterday, December 18th, U.S. Surgeon General Jerome Adams declared youth e-cigarette use an epidemic as part of an advisory he put out. And it's a term he said he does not use lightly. The FDA commissioner, who was the person who was shown on the slide, had called it an epidemic back in September of this year. And what caused them to do this was two surveys, CDC's 2018 National Youth Tobacco Survey and the 2018 Monitoring the Future Survey, released within the past 2 months, that showed a truly dramatic spike in youth e-cigarette use from 2017 to 2018. And I'll go into a little more detail about both these surveys later, but later on in this presentation. So, but first, what are e-cigarettes and why they become so widespread? Thought we'd do just a really brief history, specifically how did a product that was introduced to the U.S. market in 2007 from China, where it was created, become an epidemic among youth in 10 plus years. So first of all, I wanted to kind of get what are we talking about when we say e-cigarettes? We use, at least the Lung Association, we use that term broadly to refer to all e-products that might be on the market. They've evolved over the years, but e-cigarettes are devices that generally have the shape of a cigarette, cigar, pipe, or pen, and do not contain tobacco. They use a battery and contain a solution of nicotine. Almost all of them do contain nicotine, despite what you may see or hear, flavorings and other chemicals, some of which may be harmful. When electronic cigarettes are used, the nicotine solution turns into an aerosol that can be inhaled into the lungs. The rechargeable e-cigarettes, and you see them on the screen, they look like USB or flash drives, have been some of the more recent innovations among e-cigarettes, and they're the Juul style of e-cigarettes. And you may have heard about Juul from various news reports and that kind of thing. But there are also a number of lookalikes as well too that other companies have developed. The other major type of e-cigarette is the tank model. A brief history of kind of FDA regulation on e-cigarettes and FDA authority over them. One thing I wanted to know specifically about this slide is the 4-year gap between 2011 and 2015, and this was during the Obama administration, between the time FDA announced it would begin to regulate e-cigarettes and when it issued its proposal. This would be important, and I'll show why in a moment. It took another year after that for FDA to finalize its authority over e-cigarettes and also other tobacco products as part of a deeming rule that they issued. And then we also had another delay as well too. The FDA told e-cigarette manufacturers at the agency yet last year that the agency would delay the deadline for submitting their products for FDA review. And this is generally required for all tobacco products that are new from 2018 to 2022. So it's until 2022 that there will be any meaningful regulation over e-cigarettes at this point. And actually, the Lung Association has sued the FDA for this arbitrary and capricious delay. That lawsuit is still pending.
Thomas.
Yes.
Sorry to interrupt you. we can see your notes. If you go to the display setting above your screen, uh,
Oh,
to your to
thank
your
you.
to your left, and then
Okay.
click on it and yeah, can you just swap it?
Yep.
Click on that one. There we go.
Okay.
All right.
How do I advance slides then?
Just
Oh, okay. Never mind. Yep, I got it. Okay, good.
all right.
Okay. So to continue this, on November 15th, the same day, CDC published new data showing a 75% increase in e-cigarette use in just 1 year by high school students. FDA made an announcement in response to the huge jump in youth use. And we'll talk a little bit more about that later on. But first, what are e-cigarettes and how they become so widespread in particular? During that 4-year delay that I mentioned during the Obama administration, the e-cigarette industry basically pulled out every trick in Big Tobacco's playbook to increase the market share of their products. From enlisting celebrity spokespeople, like on the screen, to candy and fruit-flavored products, and also cartoon images to attract kids. And these are all real advertisements from e-cigarette companies, I'll note. So, and also real flavors as well too. There are, I think, somewhere around over 15,000 unique flavors that have been developed for e-cigarettes. So this is just a small smattering of ones that are out there. And also making unproven and dangerous health claims like these, that pregnant smokers should use these cigarettes. We do believe that. So the top sentence, we do believe the sentence is mangled because it was translated from Chinese, so to an English using a software program. And during that time, despite the fact FDA could have cracked down on the products that claimed to help smokers quit, the Obama administration could have finalized the rules that would allow them to protect kids from these products at any time. They did not. So this really fueled the disinformation campaign about e-cigarettes and also the increase in use that we're seeing among youth. And so, as I mentioned before, we saw a dramatic spike. The first dramatic spike in youth e-cigarette use from 2011 to 2015, and during that time frame, especially among high school students, as this chart shows. We did see a decrease then back in 2016 and back to a lower number in 2016 and 2017. But then you'll notice the huge spike in youth use this year, and then this is results from, and so that these were results released on November 15th, 2018, from the CDC's National Youth Tobacco Survey, which is done every year, and this is from 2018, and that showed a 78% increase among high school students from 2017 to 2018. And it's one of the kind of data points in youth e-cigarette use being an epidemic. The reason mostly Juul is responsible for this increase at this point, and related products. So a few more kind of key facts about e-cigarettes use among youth. E-cigarettes are the most commonly used tobacco product among youth and have been since about 2015. Youth are more likely to use e-cigarettes than adults. As you'll see, adult use is 2.8%. That's from the 2017 National Health Interview Survey. And then 20.8% of high school students and 4.9% of middle school students currently use e-cigarettes. That's from the 2018 National Health Interview Survey. Or sorry, from the 2018 National Youth Tobacco Survey. And then we also had a survey released just this past Monday, December 17th, and that was the Monitoring the Future survey, another survey that's done every year by researchers at the University of Michigan, funded by the National Institute of Drug Abuse. They saw an even more dramatic spike than even the 2018 National Youth Tobacco Survey. A 90% increase among 12th graders, 96% increase among 10th graders, and then a 74% increase among 8th graders. This was all from 2017 to 2018. Researchers said this is the single largest increase in the survey's 43-year history for any adolescent substance use outcome in the U.S. And then vaping of any substance also increased substantially, reaching 26.7% among youth 12th graders. And by any substance, we mean also that oftentimes there's use of marijuana in e-cigarettes as well too, and that kind of thing. So, but this is one of the data points that caused the Surgeon General to call this the youth use of e-cigarettes an epidemic. So a little bit quickly on the health risks of e-cigarettes and what we know about them so far. E-cigarettes can cause unintended injuries. You may have seen people may have seen stories about defective e-cigarette batteries that have caused fires or explosions. This is the reason why they aren't allowed in checked luggage on airplanes, for example. And then in addition, acute nicotine exposure can be toxic. Children and adults have been poisoned by swallowing, breathing, or absorbing e-cigarette liquid. So that's another potential risk. And one that when we in the early years of e-cigarettes, we saw pretty dramatic increases in calls to poison control centers about this issue. So. Most e-cigarettes contain nicotine, despite what people may hear, which has known health effects. Nicotine is highly addictive. It's toxic to developing fetuses. And then nicotine can harm adolescent brain development, which continues into the early to mid-20s. According to the Surgeon General, the advisory was just released, there is no safe level of adolescent exposure to nicotine. What is the e-cigarette aerosol? I think that this is the impact that the Lung Association is most concerned for because of our focus on lungs. The impact of inhaling these chemicals into lungs. And according to extensive research conducted by the FDA, these health risks to the lung and to the brain are what resonates most with youth and what could convince them to stop using e-cigarettes as we learn more about them. There are a couple key ingredients. One of the key ingredients in e-cigarettes is propylene glycol or vegetable glycerin, and these are not safe to inhale. The e-cigarette industry often claims that that these ingredients are on FDA's generally recognized as safe list or GRAS list, and you have GRAS status, which you might have heard. That's only for ingestion. So only if you eat it, not for inhalation. And a recent study from the University of North Carolina found that even in small doses, inhaling propylene glycol and vegetable glycerin in an aerosol form is likely to expose users to a high level of toxins. But the more ingredients the user is inhaling, the greater the toxicity. Back in 2016, the Surgeon General released a larger and longer report on the youth use of e-cigarettes. And one of the things they found was that they could be a gateway to traditional tobacco products, and that youth who would otherwise not use any tobacco products, or a proportion of youth that would otherwise not use any tobacco products, are using e-cigarettes, and then they'd be transitioning over to traditional cigarettes. Potentially. A couple other important conclusions from that Surgeon General's report as well too. E-cigarette aerosol, that's the secondhand emissions that are produced when a user exhales. Basically, it contains potentially harmful chemicals, and then also that flavors are one of the main reasons kids use e-cigarettes. So. A couple of important conclusions there that are And the flavors are one of the things that are fueling the youth e-cigarette epidemic that we're seeing. Another important report came out this past January 2018 from the National Academies of Science, Engineering, and Medicine. There was kind of an analysis of all major e-cigarette studies, major studies on e-cigarettes to date as of then. And their conclusions included that using e-cigarettes can cause health risks and also increase the likelihood of kids using and becoming addicted to regular cigarettes. And they also confirmed that exposure to others to dangerous secondhand e-cigarette emissions as well too. The Food and Drug Administration has not found any e-cigarette to be safe and effective in helping smokers quit. Unfortunately, what seems to be more likely to happen is smokers will use both e-cigarettes and cigarettes, and this is often referred to as dual use. And unfortunately, a smoker who does that does not reduce their risk. And in fact, more than half of all adult e-cigarette users continue to use traditional cigarettes at the same time. And then there are also been studies out there that have shown only 10.1% of smokers who used e-cigarettes had quit smoking after 6 months, compared to 26.6% of smokers who do not use e-cigarettes or some other method of quitting, either cold turkey or other forms of smoking cessation. This is from a study in the Annals of Internal Medicine. So how have we been addressing this epidemic so far? In November 2018, FDA Commissioner Scott Gottlieb announced they would proceed with removing all menthol cigarettes and flavored cigars from the marketplace. And this is a move the Lung Association strongly supports. It thinks it's a good thing. However, FDA did not really meaningfully address the marketing and flavors from e-cigarette companies. It does not prohibit flavors and will only restrict the sale of some flavors to age-restricted areas and retail stores. Instead, FDA said that and all flavors, and that will apply to all flavors except tobacco, mint, and menthol, to age-restricted sections and within convenience stores. And the Lung Association really doesn't think this is sufficient enough to address the e-cigarette epidemic among youth. A particular note, this new sales restriction policy on the part of FDA would only apply to would not apply to mint and menthol e-cigarettes. However, data released on November 15th, that same date, November 15th, 2018, from the 2018 National Youth Tobacco Survey, show that more than half of all high school students who use e-cigarettes use mint and menthol flavors. So this basically makes it so that half of the e-cigarettes used by youth who currently use e-cigarettes would be exempted from the policy, which is certainly disappointing and makes it unlikely this would result in meaningful change. One good thing to note about what FDA has done so far, they did launch a public education campaign focused on preventing the youth use of e-cigarettes in the fall of 2018. This is an extension of a campaign they've been doing around tobacco products in general called the Real Cost Campaign. The Lung Association certainly strongly supports this campaign. It's aimed at preventing youth from starting to use e-cigarettes, and they did extensive research about what the most effective messages that would reach youth. And resources are available at the Real Cost campaign, therealcost.com, if folks want to see more on the campaign and kind of some of the things they've been doing. While FDA delays, states and localities are working to fill the void, and should work to fill the void. There are a variety of actions, as you see on the slide, that states and local communities could take. One thing I'll note, certainly is that while FDA is figuring out any policies that may do around flavors, states and communities can certainly take action to prohibit the sales of flavors in all tobacco products. But also adding e-cigarettes to smoke-free laws and other things like that, and funding tobacco prevention programs so that they have the resources to focus on education around e-cigarettes, for example. So, variety of things that states can do. Quickly, a little bit about the American Wellness Association has decades of experience in successfully helping smokers quit using proven ways that FDA and the science have found are both safe and effective. You'll see a few of those up here on this slide. Freedom from Smoking is our gold standard. Is our gold standard quit smoking group counseling program. It's both an online program, in-person group support program, and our Lung Helpline is available to everyone. So these are some methods that people can use if they are interested. And then one other thing, lung.org. Then I'll just note that all of our resources on e-cigarettes are available in one place, lung.org/e-cigs. As you see there, we've recently revamped the page to be concise about to be more concise, but also there's some resources for parents and teens. I think teachers and education professionals as well too. So there's some good resources that we created, some one-pagers that people can use there as well too. There's also some links to other trusted resources on e-cigarettes, including CDC and FDA, which has some extensive information on e-cigarettes too. And with that, I will be happy to pass it back to Dr. Leone and Bob Burns for any for further discussion.
Hi, Thomas. This is Bob Burns at the National Center, and thanks for that very informative presentation. And while people are kind of thinking about questions and so on, I just want to ask just kind of one general question. I guess it always comes to mind, and I think I probably put it to you before, but I'll ask it again. At this point, why are companies even allowed to sell e-cigs or vapes? Given that all it is a nicotine delivery system, and nicotine is a known addictive substance.
Well, there's this is part of the complicated history of e-cigarettes. FDA back in 2009 or 2010, I think, wanted to regulate e-cigarettes as a drug delivery device. So kind of like how how other medical devices are regulated, because it delivers a drug, nicotine, that is addictive. So unfortunately, a court decision in 2011 stopped them from regulating them as drug delivery devices and basically required them to regulate them as tobacco products. So that's why they've taken e-cigarettes under the tobacco product authority they have, and finally, back in 2016, actually gained authority over them to be able to regulate them.
So is that decision definitive and inexorable at this point?
Unfortunately, unless something changes dramatically, probably yes. So. I think, unfortunately, the cat is out of the bag with being able to regulate them as drug delivery devices and try to get them off the market permanently. So, although I will note that FDA does have pretty comprehensive authority over e-cigarettes, and one of the things I mentioned during the presentation was that they do have the power to require e-cigarettes that came onto the market after a certain date in 2007 to submit new tobacco product applications. So that would mean that they are a new tobacco product, and there may be some way to get some of the more egregious types of brands or types of e-cigarettes off the market in that way. But FDA actually has to use that authority, and at this point they've delayed that ability to do that until 2022, as I said.
Okay, thank you, Thomas.
Thank you, Thomas. From the National Center for Health and Public Housing, we would like to once again thank Thomas for his wonderful presentation. He referred to this problem as an epidemic, and I believe this is that's the right term. You know, after seeing all the data that he presented, and I would like to ask those on the line or those participating if they have any other questions for Thomas.
People are thinking about Christmas shopping today or something. They're not, or being bashful. I'm not sure what it is.
Hello, my name is Maria, and I'm part of the San Isidro Health. We're a community clinic, and we have a mobile clinic that attends 2 high schools, and I'm interested in knowing where I joined the call a little bit later on, so I know you talked about your website. I was wondering if you have some kind of information that we can hand out to the students that we can give out through our mobile clinic.
Yeah, there's like I said on lung.org/e-cigs, e-cigs. There is a one-pager for parents and teens about e-cigarettes that I think probably would be particularly appropriate for what you just said. So feel free to take a look there, and you know I'm happy to, if you do have questions, I'm happy to try to answer them too, you know, later offline. So.
Great. Thank you for the question. What we are going to do is that we are going to share Thomas' presentation after the webinar or after this call. So you can take a look at the resources and everything and all the materials that he presented today.
Thank you. That will be great. That way I get to share with the school nurses as well. They're always looking for resources. Thank you.
You're very welcome. I'm sorry. Where are you located again? Where is the health center or the mobile clinic located?
We are in San Diego, California.
Okay. Excellent. Thank you, Maria.
Our center is right across the border. It's our first trolley station, and we have several health centers throughout San Diego area.
So are you by San Isidro or?
Yes, it's actually San Isidro Health. That's the name of our health center.
Oh, very good.
Thank you, Maria. Any other questions for Thomas?
And if not, Thomas, I'll throw one out to you just because as you were going through, your slide where you have your graph, and you kind of show the spike in e-cig use over the last year, that 78% increase amongst high school students, from 11 to like 20 or 20.1%. Do you guys have a handle at this point on what caused that spike? And I guess so all of us could think about how we would want to address it and attack it and turn it around.
I will say we believe it is mostly due to the Juul products. So the ones that look like a USB flash drive, basically, and are designed in a way to be used kind of surreptitiously. We think that is largely responsible for the increase, and the data just started to, and really the surveys have just adjusted to actually account for those. A lot of kids refer to it as juuling, not necessarily using an e-cigarette. So there was a little bit of a lag there. We think maybe, but it's also really taken off recently in terms of kid use of those products in particular, and companies making look-alike products as well too. So.
The other day when the Surgeon General's report came out, I guess just on Tuesday, there's some follow-up, or as part of it, some discussion around nicotine salts and kind of, I guess, ways the manufacturers are kind of increasing the addictive, I guess, power, of the vapes, the e-cigs. Is there any effort to address that legally or otherwise?
Yeah, I mean that was one of the things. That was certainly one of the things I found that was disturbing. What the advisory found was that nicotine salts, and this is what is used in Juul and perhaps other products, although I can't speak to that. That it's a new way of nicotine delivery, basically. That has more. That basically has less of a throat hit, so it has more. It kind of masks the addictive potential, and is particularly disturbing. So I mean, FDA in theory should have authority over the products to actually do something about this. Whether they will is another story, but yeah, it's particularly problematic. Obviously, and I will say that, and the other thing about Juul as well too is that each pod contains about the same amount of nicotine as a pack of 20 cigarettes. So that also increases the addictive potential too.
Before we move on and ask some questions to the audience, Thomas, one of the main concerns in the clinical community is that these devices can be modified and you can use other psychoactive substances. Is there any study or if there is any additional information? I was reading an article probably last week regarding the use of marijuana if you modified one of these devices, and specifically that is more pure and concentrated, so the effects take longer, to dissipate, and probably the symptoms or the feelings of excitement or anything that is related to the use of these substances is basically more or is longer when someone is smoking through these devices. Is there any how the community and the American Lung Association is planning to tackle this issue?
I mean, I don't have a lot of deep knowledge about whether it's a more pure form of inhaling marijuana. I will say we're certainly opposed to the use of marijuana through e-cigarettes, and we are fighting to make sure that marijuana through e-cigarettes or in the inhaled form as well too is included in state laws restricting smoking. So that is one thing we're very much in favor of, and it's been a big battle in states that have legalized marijuana in particular. So it is. But I do not have a lot of in-depth knowledge about the studies around that. I certainly know it's happening. The Monitoring the Future survey, like I said in my slides, that includes the 26.7% youth use figure includes a use of marijuana through e-cigarettes too. So.
Thank you, Thomas.
And Thomas, one thing that was of interest was the survey that was done actually a couple of years ago. And I forget which group did it, but it dealt with the whole issue of flavors and kids. And basically, I think in the survey, the responses from high school kids indicated that about 80% of them went or started using e-cigs or vapes because of the flavors. And there's been a whole bunch of focus about eliminating the flavors or limiting the access to flavors. And at a partners meeting with CDC and the Lung Association and Cancer Society and a whole bunch of other Truth Initiative and a bunch of other people very interested in solving this problem. There was a lot of discussion about it and about restrictions that were being imposed on the availability and access of flavored e-cigs to kids. So could you delve into that just a little bit?
Let's see. Well, so FDA. So this is in my slides too, but FDA is what they are doing, and what they announced on November 15th is, and this is an intention at this point. They have not really issued anything concrete yet. Is they would restrict e-cigarette sales of many flavored e-cigarettes to age-restricted locations in stores. So, or age-restricted stores in general, where some stores are basically above age 18, or 21 in some states, presumably. And so that is something that, that's something they are looking at. And then there are some states that are looking at it, and states and local communities, especially in California, that have been passing laws that would prohibit the sale of flavored tobacco products, basically, including e-cigarettes.
And Thompson, I mean, this is maybe not a fair question for you, but I just think for all of us, I mean, the reality is we all know some enterprising 21-year-old or 18-year-olds who will go to the adult-only smoking store and make a large purchase and go into business for himself, him or herself, selling these stuff to kids. Is there any kind of movement or any suggestions or guidance out there how either most of the folks on the call are either health centers or public housing agencies, and how we can in some kind of team approach address this and try to prevent that from happening?
Boy. Are you all hearing that good, by the way?
You sound good. I don't know. Are we sounding bad to you?
Yeah, I'm hearing an echo.
Oh.
Okay, maybe not anymore. Okay, good. Good luck.
So, and Thomas, yeah, I'd be interested in your thoughts, and then if any of the folks on the phone have a thought on that, because to me it's almost akin to my deep dark past when when the drinking age, when we were kids. Well, we'd always find somebody's big brother who was willing to help us out, and I would say that if you're really trying to get to get your menthol jewel, that you could probably find somebody who'd be willing to buy it for you.
Yeah, I mean, one thing I'll note is tobacco 21 laws can also help with that too. So getting the age up to 21 as opposed to 18. So
how is that going?
So what that would mean is that it would at least restrict. It wouldn't help as much of young adults, but it does restrict, say, 15 to 17-year-olds from getting e-cigarettes. That seems to be the primary population where tobacco 21 laws have a bigger impact, because they don't have as much access to 20 to 21-year-olds, basically. And then let's see so that's one possibility. I'm trying to think. I mean, I am trying to think about kind of in the community health center or public housing context. I'm thinking kind of. I mean, really, what we kind of need we need more education about for community health centers that see kids, for example, about the fact that the nicotine that basically, especially Juul, basically most cigarettes contain nicotine. They are addictive. Flavors are one of the reasons why kids use them. So I think that's probably the nexus I would see. But I would certainly I'd be happy to comment on any other thoughts, certainly. So.
Yep. And related to that, and related to the earlier question, just pass along a few times into the rest of the group. We've been involved in a pilot. Our director of research and policy, Dr. Saki Cho, has been working with a few health centers around the country using CDC tips for smokers materials, both print and video, and has had extremely outstanding results, improving the number of patients seeking assistance and getting health professionals in the health centers kind of actively engaged in the whole notion of prevention and treatment of smoking. And I'm just wondering, and you mentioned earlier, do you think the materials that you have are at that level? And I'm wondering if CDC is doing anything or considering doing anything around e-cigs in terms of their TIPS program.
So I'll answer the last question first. They did do one ad on basically dual-use cigarettes.
Yeah.
So there's one story about that could be useful for basically trying to spell the message that dual use is that dual use doesn't hurt people, basically.
Yep.
Let me see, and then I mean, I'm not sure our materials are at CDC's level. I mean, but they do have. It could be good. CDC's more testing, but the cdc.gov/tips, or sorry, cdc.gov/tobacco. They do have a lot of they do have a number of e-cigarette materials you can develop recently, focused on tips. So that could be a place to look. I know there's some good infographics on there that could be used in social media and that kind of thing. I know we use them quite a bit.
Yep.
And then there are also some kind of brief fact sheets and that kind of thing online. So I think so. So that might be also another resource to check out.
Okay, excellent.
All right. Okay, thank you, Thomas. And we would like to ask some questions to those participating today. We have presented some very good data on the use of electronic nicotine devices on e-cigarettes. And I know that we have some community health centers and some public housing agencies participating today. And we would like to ask them some questions. The very first question is, how prevalent is the use of any of these devices, or if this is a concern in the community? Specifically now, after the House rule banning smoking in public housing, the rule basically is for lit cigarettes, but it doesn't address the use of e-cigarettes and electronic nicotine devices. So the question is, how prevalent or how common is the use of these devices in your community, and if this is a concern for public housing agencies and community health centers? Someone from a public housing agency or community health center who would like to tell us and share your experience with the group. All right. I don't want to put anybody in the spotlight, but anybody? I see a couple of guys participating. We have Amy Irvin. Amy, do you have any comments or anything that you would like to share with the group? So I believe that we're kind of shy. Maybe the holidays.
It's okay. People distracted. I understand.
All right. Well, we have some other questions that probably you would like to address. You know, there are several issues going on, and specifically, what is the the question that we have is around social factors. Thomas mentioned some of these social factors. Again, I mean, what are you seeing in the community at the health center level or in the public housing agencies? Anyone who would like to share any information with us?
No, quite. But that's okay. That's okay. Thomas, question. I guess a question I have is, right now, obviously we've just gone through kind of we're in the middle of the first year of implementation on smoke-free public housing, and I think that there's been kind of a renewed focus and interest on tobacco cessation, and we're certainly trying to promote that. And Juul, markets itself, of course, as an off ramp, for cigarette smoking, and the data that's come back does not necessarily support that. And I'm just wondering, is there any effort to get Juul to stop making the claim, or any of these e-cig companies?
Well, once again, that is up to FDA, unfortunately.
Yeah.
And it is an open question of whether they will address that. There's very little evidence that Juul is, based on, like I said, Juul is responsible for a good chunk of the increase in youth use we're seeing. So it's hard to support that claim that they're making about them being an off-ramp when they seem to be more of an on-ramp for you. So.
Yep. And one thought I had, and Jose might have some feedback on it, or if we have any other folks on the line, especially on the clinical side. And of course I know in a sense it's a burden because it's one more thing that has to be asked. But when a doc or a clinician has a patient come in, whether it's for their annual visit or something else, there are a set of standard questions that they ask. And the question on smoking, I think, has been around for years, and it's commonly asked. And health centers, for example, have to measure how many people at least identify as smokers, which classifies them as having a smoking disorder. But I'm not sure whether or not the question or the protocol includes, as a standard, a question regarding use of ends or e-cigs, vapes, and it seems like, of course, that it should, especially in light of the kind of the horrendous increase that we've seen over the last year. I'm just curious if you've heard any movement, in that area, and I don't know if Dr. Leon has any thoughts on it as well.
Well, the performance measure that health centers use is basically for tobacco in general, and it doesn't address the use of any of these devices. I haven't seen any movement yet. I am quite sure that this is going to be a topic for discussion. I'm quite sure that HRSA and Medicare will address this, because most of the performance measures that health centers report on are Medicare, Medicaid performance measures.
Yep.
So I am quite sure that in the future they are going to include that question. But at this moment, health centers are only reporting the use of tobacco in general.
One thing we could do is, because it's obviously it's a pretty important issue to our folks in and around public housing, and probably to all health center patients across the country, is maybe pose the question to HRSA and maybe to Judith, the chief medical officer at HRSA, at the Bureau of Primary Health Care, and just ask her right now, if there's an initiative, and if not, why not, kind of thing. So I think that's something that we could probably do. We might not get their attention right before the holidays, but we might be able to get it right after. That's right. So maybe we can kind of put that on our to-do list.
Well, and one thing I'll add to this is if the question is a general tobacco question, I mean you could create maybe the definition of tobacco could be expanded to include cigarettes. So.
And then
might be an easier lift potentially.
And the nicotine in e-cigarettes is derived from a tobacco product. That's why it's considered a tobacco.
Yeah, I mean, some e-cigarette companies take into claim that they derive their nicotine from other things. That doesn't seem to actually be true, that we can determine, or that FDA can determine. So most of them, basically all of them are derived from tobacco.
And Thomas, to kind of go back to the root, you were talking about what e-cigs are, and remember a lot of the impetus behind the smoke-free public housing rule was to prevent secondhand smoke, and it seems to be that based on the information that you have and that folks are presenting is that it's not safe, and so does it have impact on a second-hand basis as well as a first-hand basis?
Yeah, the aerosol, and it is aerosol, not water vapor, like the companies want to say it is. It comes at a user exhales, or sorry, exhales. That's the stuff that can cause damage, basically. I mean, as I said in my slides, there's a couple reports. The Surgeon General's report in 2016, the National Academy's report in 2018. So there are a number of studies out there that have said that it is not harmless. It's possible it is less toxic than cigarette smoke, but it is not harmless, and the comparison should be to clean air anyway. So and I think, I mean, in the context of public housing, the Lung Association certainly supports including e-cigarettes in smoke-free housing policies. We think there's also a benefit in terms of enforcement there as well too, in addition to making that easier. In addition to preventing harm from secondhand e-cigarette emissions. So.
I think that was an option, but not a requirement. And I don't get
that is correct. Yes, it was an option, but it is optional. The PHAs can do it, but it is not required by the HUD rule. So yes.
Thomas, one more question. In regards to the data that you presented and the spike in the numbers, that health centers and public housing agencies specifically work with low-income population. Is there information about the
rates?
Exactly, but by social level, for instance, or if this is more an issue that is more common in people with low income, or is not a low income issue?
Sorry, could you? I had a little trouble understanding the question. Could you repeat that? I apologize. I'll try it a different way, maybe.
Basically, Thomas, we're just trying to see if there's any data that talks about the usage of e-cigs based on socioeconomic status and demographic characteristics. For example, public housing residents or HUD-assisted adults, about 33.5% of them are smokers. About 34%, an even slightly greater number of folks who are in low SES status are smokers, compared to the general public. So we're just wondering if there are similar numbers available and out there around e-cigs.
Yeah, so I'd have to go back and check the 2017 National Health Interview Survey. That is, so I'm not completely sure if they break it down that way. They certainly might. I know they basically expanded this year to include, it's basically now an all tobacco products report. So I can go back and check that, but I don't want to quote something I don't know, basically. So.
Yeah, but that would be interesting.
Okay. Well, it's 2 o'clock. I believe that we have addressed this issue one more time. We would like to thank Thomas and all those who are on the call today. Thank you so much for participating. Thank you so much for your support. If you have any additional questions or if you would like to get additional information from either the National Center for Health and Public Housing or from the American Lung Association, please feel free to contact me. I am going to send the slides after the call. And if there is any question for Thomas Carr, I will be more than happy to forward your question to Thomas and the American Lung Association.
And our next call will be in March?
In March.
Okay. And so we will be getting a notice out about that.
That's right.
And I want to wish everybody, happy holiday. And, thanks again, Thomas. Really appreciate it.
Happy to do it. Thank you.
Thank you. Thank you, everyone.
Take care, all.
Happy holidays.